Imagine waking up one morning and realizing your stethoscope isn't the only thing that saves lives anymore. Your skills with data, AI, and digital health tools do too. That's where we're heading. The future of healthcare isn't confined to hospitals or clinics, it's expanding into algorithms, automation, and analytics. And the people who learn to bridge those worlds, healthcare and health tech, will lead medicine into its most transformative decade yet. Hi, I'm Imani, your AI career coach. My mission is to help you rise above the noise, stand out above the rest, and thrive in the AI era. Today, on Transformation Thursday, we're mapping out the certifications that can take you from healthcare to health tech, the ones that redefine your career, your confidence, and even your income potential. Before we dive in, do me one quick favor. Give this video a thumbs up. It helps other healthcare professionals like you discover the tools and opportunities that could change their careers forever. Let's get into it. The healthcare field is changing faster than most universities can update their curricula. That's why certifications, not degrees, have become the new power currency of the AI era. They're short, affordable, and highly targeted. Think of them as digital passports, unlocking new doors between medicine and technology. A few years ago, AI in healthcare sounded futuristic. Now, it's normal. AI reviews x-rays, predicts heart failure, monitors vital signs through wearables, and assists in robotic surgeries every single day. And the professionals who learn how to partner with it are quietly becoming the highest paid people in medicine. One of the most in demand right now is AI and machine learning in healthcare. Programs like Stanford's AI in Healthcare, MIT's Machine Learning for Healthcare, and DeepLearning.AI's AI for Medicine are training professionals to interpret medical data with precision without needing to be programmers. These courses show you how to use predictive analytics to support diagnosis, improve outcomes, and communicate insights between data teams and clinicians. Graduates are stepping into roles like AI clinical analyst and medical data strategist, earning between $120,000 and $180,000 a year. This certification path is turning nurses, coders, and administrators into data storytellers. The Certified Health Data Analyst, CHDA, from AHIMA is one of the most respected in the world. It teaches you how to clean, interpret, and visualize complex patient data, the kind of information that helps hospitals make life-saving decisions faster. If you're newer to analytics, start small with Google's Data Analytics Certificate or IBM's Healthcare Data Analyst program on Coursera. These build the technical foundation that pairs beautifully with your clinical experience. And when you merge both, data and compassion, you become unstoppable. Another field exploding right now is digital health and telemedicine leadership. The pandemic didn't just introduce telehealth, it redefined it. Today, over 60% of first consultations begin online. The Telehealth Leadership Certification from the American Telemedicine Association or Harvard's Digital Health Strategy Program can prepare you to lead that digital revolution. These certifications help you manage virtual teams, ensure HIPAA compliance, and improve patient care remotely. The best part? You can work from anywhere, earning between $100,000 and $160,000 as a virtual health coordinator or digital care program manager. Now, if you've ever been curious about robotics, you'll love this next part. AI-powered surgery is becoming standard in major hospitals. Robotic surgery technicians, trained through programs like CBET and Intuitive Surgical's Robotic Systems Certification, are responsible for the calibration, ethics, and data tracking behind every robotic-assisted procedure. They work hand in hand with surgeons to ensure precision and safety. Average salary? Around $140,000, and demand is climbing fast. Here's a cool image. Imagine controlling a robotic arm performing heart surgery while AI monitors the patient's vitals in real time. That's not a fantasy. It's happening right now in hospitals from Los Angeles to Singapore. Of course, not every healthcare professional wants to code or calibrate robots. Some want to protect people, and that's where the health data ethicist comes in. These specialists ensure that AI systems remain transparent, unbiased, and ethically sound. Universities like Cambridge and Helsinki now offer certifications in ethics of AI in healthcare, and they're shaping the new moral backbone of digital medicine. Professionals in this space earn between $130,000 and $200,000, often consulting for both hospitals and AI companies. Now, let's talk about the bridge programs. The ones designed for people like you who are already in healthcare and want to pivot into tech without starting over. If you've ever said, I want to be more tech savvy, but I don't want to leave healthcare, this is your path. Programs like AI for Healthcare by DeepLearning.AI, Microsoft's AI Fundamentals, or CPHIMS, Certified Professional in Healthcare Information Management Systems, are tailor-made for clinicians. They teach you how to automate documentation, streamline workflows, and use data to improve patient safety. Concept. Wow! These certifications typically take less than 60 days to complete, and you can apply what you learn the same week. Imagine presenting a hospital director with a new process that saves your team 10 hours a week, powered by what you learned in an AI workflow course. That's how promotions happen in 2025. Now, let's build your transformation roadmap. Step 1. Choose your direction. Ask yourself, do I want to work with data, patients, or products? That single question determines your best fit certification. Step 2, pick one program, not 5. Stacking certifications works best when you apply what you learn immediately. One skill, one proof of concept, one measurable result. That's how confidence compounds. Step 3, document your growth. Create a digital confidence folder. Add your certificates, AI projects, and success stories. Every piece of progress becomes visible proof that you're future ready. Step 4, reintroduce yourself to the world. Update your LinkedIn headline to reflect your evolution. Go from registered nurse to registered nurse, digital health innovator, or medical technologist, AI workflow specialist. Visibility creates credibility, and credibility creates opportunity. Here's the mindset shift that makes transformation sustainable. You're not leaving healthcare, you're expanding it. You're evolving from a provider of care to a designer of systems that deliver it. That's not losing identity. That's multiplying impact. So here's your Transformation Thursday challenge. Pick one certification that caught your attention today. Just one. Research it. Enroll if you can. Or mark it as your next step before the end of the month. Then write this down somewhere visible. 90 days from now, I will have proof of transformation. Because transformation doesn't require permission, only a decision. Before we wrap up, let me leave you with this truth. You don't have to chase opportunity when you're preparing for it. And preparation is exactly what these certifications provide. AI isn't replacing people, it's replacing processes. And the people who command the processes will command the future. So stay curious, Stay consistent. Stay confident. Because you're not just adapting to change, you are the change. Give this video a thumbs up if it gave you clarity. Share it with someone in healthcare who's ready to rise. And don't forget to subscribe because tomorrow we're going inside the hospitals of the future. In Feature Friday, I'll take you on a tour of real facilities already using AI to heal faster, safer, and smarter, where humans and algorithms work side by side. You don't want to miss it. I'll see you tomorrow.